Hello, my name is Westlake, and I'm presenting our work titled Time to Functional Outcome Optimization After Musculoskeletal Tumor Resection. The Musculoskeletal Tumor Society Evaluation, or MSTS score, is a functional outcome score used in patients that have undergone surgical resection of a musculoskeletal tumor. There is limited literature to help guide clinicians in counseling patients with regard to the time it will take them to recover after one of these such surgeries. The objectives of the study were twofold. One, to determine the length of time it takes for patients' MSTS scores to optimize, and two, to evaluate tumor and patient characteristics that have an influence on their recovery. This was a retrospective review performed on all patients surgically treated for a musculoskeletal tumor by a single surgeon from April 2016 through May 2021. MSTS scores were assessed at each of their postoperative visits. A score was not considered optimized until they had a same score scored over 2 consecutive visits, or if the patient reached the maximal score of 30. We looked at several factors that may be associated with time to their score optimization. Key results: 187 patients met inclusion criteria. The average MSTS score was 29.1 for our cohort. 82% of the population achieved the maximum possible score. You can see depicted in Figure 1 that the vast majority of patients achieved their optimized score less than a year after surgery. In Table 1, you can also see that bone tumors had a significantly higher time to score optimization, and malignant tumors also had a significantly higher time to score optimization. Soft tissue tumors that had bony work also had a significantly higher time to score optimization compared to soft tissue tumors that required no bony work. Key conclusions: the median time to MSTS score optimization was 50 days. The majority of the population, 66%, achieved their optimized score within 3 months. Bone tumors, malignant tumors, and patients that underwent adjuvant treatment with chemotherapy or radiation had a significantly higher time to functional optimization. And tobacco use was the only patient variable found to influence time to score optimization. However, this was associated with a shorter time to optimization. The majority of the patients undergoing surgery for musculoskeletal tumors can be counseled that they can expect maximum recovery within 1 year, unless they have other risk factors discussed above. Future implications: multi-center studies are needed to increase the sample size enough to allow for the evaluation of recovery times for specific tumor types. Hello, I am Westlake, and I will be discussing our study titled Time to Functional Outcome Optimization After Musculoskeletal Tumor Resection. The Musculoskeletal Tumor Society Evaluation, or MSTS score, is a functional outcome score used to evaluate patients that have undergone a musculoskeletal tumor resection. There is limited literature to help guide clinicians when counseling these patients on the time it will take them to recover from their surgeries. The objectives of this study were twofold. One, to determine the length of time it takes for patients' MSTS scores to optimize after surgery, and two, to evaluate tumor and patient characteristics that could influence time to optimization of their score. This was a retrospective review performed on all patients treated by a single surgeon from April 2016 through May 2021. Patients' MSTS scores were assessed at each of their postoperative visits. They were considered optimized when the same score was recorded over 2 consecutive visits, or if the patient reached the maximum possible score of 30. We looked at several factors for association with time to functional outcome score optimization. Key results: 187 patients met inclusion criteria. The average MSTS score of our population was 29.1. 82% of the population reached the maximum score of 30. Looking at Figure 1, you can see the majority of the population reached their optimized score in 3 months or less. Looking at Table 1, you can see there are several factors associated with a prolonged time to recovery, including patients that had a bone tumor, patients that had malignant tumors, patients that underwent adjuvant treatment with chemo or radiation, and patients that had a soft tissue tumor that required bony work as part of the surgery. Key conclusions: the majority of the population reached their MSTS optimized score within 3 months. Bone tumors, malignant tumors, and treatment with adjuvant chemotherapy or radiation was associated with a significantly longer time to score optimization. Tobacco use was the only patient characteristic found to influence time to score optimization. However, we found that the tobacco users also were mostly made up of patients with benign soft tissue tumors, which were independently to have shorter times to optimization. The majority of patients undergoing surgery for musculoskeletal tumors can be counseled that they can expect a maximum recovery within 1 year unless they have some of the risk factors discussed above. In the future, multi-center studies will be needed to increase sample size enough to allow for evaluation of recovery times for specific histological tumor types.